While the video included a student in a simulated experience, an anecdotal note template can be useful for all clinical instructors in a variety of environments. Let's take a moment to consider how an anecdotal note template can support a clinical instructor and give them confidence in their ability to evaluate students. Research shows that many clinical instructors may be expert in nursing, but may have very little background in teaching or grading of students. So how do we evaluate student performance? What actions and behaviors indicate a student is showing safe nursing practice and critical thinking? It may be difficult for a clinical instructor to remember every interaction with students, as clinical environments may have up to 4 to 8 students. An anecdotal note template could be useful also to provide legal documentation to support grades and patient safety. With the provided anecdotal note template, you can see that there is a patient data section. This patient data section may help the clinical instructor cue into appropriate Socratic questions to ask throughout the clinical day by being reminded what the patient's diagnosis was and any pertinent labs. This anecdotal note template can also help break down observations into more useful and more specific evaluative data. This is seen in the noticing and assessment sections, interpreting, prioritizing, and responding in communication sections. In this last particular video, we will start with the patient data that was given to the clinical instructor and the student, which is the patient was Mr. Smith. They're a 70-year-old male. Their diagnosis was congestive heart failure, and there was a provider order to keep the pulse oximetry greater than 92%. One of the patient-centered care needs was that the patient is a little anxious and they prefer jokes. That was given in the night shift to day shift report. In the student performance under noticing and assessment, one of the things that a clinical instructor may be cued to note was that the student did quickly recognize the cue, and that was that the pulse oximetry was low and that the nasal cannula oxygen had fallen off in the night. They also cleaned their stethoscope and they did a focus respiratory assessment. They were able to properly interpret and prioritize data. As they noted, the student was able to note that the nasal cannula being off was a priority and they promptly replaced it. They also, you could even write in here that they, set the patient's head of the bed up, those types of behaviors as well. One of the safety things noted was that they did put the call light in reach, which was, a positive safety thing to note. Responding in communication, the student did knock. They do use hand hygiene, although it may not be clear in the video. They did introduce themselves. They did check the armband. Their hair was pulled back for professionalism. And they did try to maybe have some polite conversation with the patient, and they did show concern for patient feelings. Lastly, we have our reflecting and evaluating outcomes. So this student, a clinical instructor, could document that, again, they did have the priority that they noticed that the pulse oximetry was low. The student properly responded by putting the head of the bed up. They replaced the nasal cannula. And then in the video, you can see that the student actually pauses and reassesses after the oxygen is to make sure that it is coming back up. The student notes that they are aware of the provider orders, and they most definitely seem to be aware of that plan of care and what is best for the patient. You can go back and review the video again and see if there's any other behaviors that you would want to add to the documentation for that student encounter. Next, we're going to watch a video of a different student and again use the template to see what type of student behaviors and performance that we are cued into.